Entering this village, all we can see are sick people.
Difficult to walk with legs, scare pains in the legs.
The old gentleman didn't even have the strength to go to the clinic or hospital. All he can do is wait for doctors to visit him.
Actually, he is not that old, but there are problems with the lungs, and a problem with his joints, and problem with the eyes. This is the first time our medical team has set foot in Africa, and we are thinking about how to get them back to good health as soon as possible.
Actually, there are medical cases everywhere during this visit. A little baby was carried by a young mother because of cellulitis, which caused high fever. Tzu Chi volunteers immediately called the local taxi to get them to the clinic.
The mother showed us the wound, and the baby immediately started crying. How did we treat the child? We did what we could and immediately sent him to surgery or pediatrics.
They don't have many chances to go to the hospital to see a doctor, and then they may think that such treatment may not be very helpful. They may not be that motivated, so we have to confirm that they want to get on the bus.
Tzu Chi has held a large-scale clinic at Nhamatanda. A Mego school starts from 9 in the morning, and the crowd continues to grow. For the local residents, this might be their only opportunity in this life to see a doctor.
What we saw was a very primitive medical condition. Almost no one has ever seen a doctor. They have a lot of illnesses that are very serious, but there is almost nowhere to do anything. We just came here, and some people have serious illnesses, but he doesn't know.
AIDS and tuberculosis are very serious problems. After this windstorm, some no longer had access to medicine, and AIDS spread to young people, and they can no longer be saved. This is one instance.
One time, okay?
Yeah.
Because they are illiterate, we use diagrams to show them.
The locals here are generally not highly educated, and some even do not graduate from elementary school. Therefore, the Tzu Chi Free Clinic took their medicine list and used simple patterns to indicate the number of medications. Many people are very curious about acupuncture needles and how traditional Chinese medicine can help relieve pain.
Several people felt really afraid. We did something to appease them a little bit. We told them to take a deep breath, and then we put in the needles. They also found it very strange that what should feel like a shocking pain did not hurt, and actually soothed them a lot. This was a big surprise for them.
This kind of sorrow and compassion transcends language. Depending upon the disease, all these doctors worked with a kind heart and gave them comfort during this difficult time.